For the first time in medical history, we have the ability to actually slow aging in humans. If we modify our nutrition, we could actually slow down the aging process by as much as 10 to 15%. You need to get at least 30 to 45 minutes per day of both aerobic exercise, which is either running, biking, swimming, whatever you prefer to do, associated with at least 20 to 30 minutes of resistance training, both upper and lower body exercise. In a study in mice, they found that a compound in red wine called resveratrol, when given to these animal models in very high doses, actually slowed the aging by 30%. If it's white, don't eat it. If it's sweet, try to avoid it. And if it's a soda, don't drink it. Fat produces about 35 different chemicals or hormones that cause disease. In fact, a lot of the hormones produced by the fat tissue raise blood pressure directly. They cause your genes to become abnormal and you get cancer. The number of diseases caused by obesity is so huge that if we don't get a handle on preventing obesity, we will break the national health care budget probably within the next 10 to 15 years. Obesity is an increase in fat tissue all over your body. But the most dangerous place is right here, central adipose obesity, abdominal obesity. This is what causes a lot of the diseases.
Dr. Mark Houston, director of the Hypertension Institute of Nashville and Resume.com's anti-aging expert, says we don't realize how the lack of exercise coupled with an unhealthy diet can truly age us.
Well, fats and sugars age you quickly through a lot of different mechanisms. They make your body inflamed, they increase your risk for diabetes, high blood pressure, high cholesterol.
Orrin, as a patient of Dr. Houston's, knew he had to take action. But Dr. Houston says to take action, you first have to determine what factors may be aging you. He recommends tests ranging from a bone density scan to look for brittle bones, ultrasound tests to evaluate arteries, a treadmill test to determine heart function, plus a weigh-in and blood work to look for factors linked to disease.
All these things will predict a disease that may occur 15 or 20 years down the line. If we catch it now, we can intervene, not with drugs necessarily, but with good lifestyle changes.
As for Orrin, his next step, a meeting with Dr. Houston's nutritionist to develop a lifestyle plan to trim down and shape up. The key, deciding what would work best for Orrin. That meant adjusting work hours to exercise. So Orrin told his boss at Deloitte Services his lifestyle change had to be a priority.
They have been very flexible as far as time goes. They understand my need to make time for myself and for this new lifestyle, we'll say.
In fact, Orrin's exercise plan started at work.
When I first started, one of the first things I did was park in the very last part of the parking lot, just as a simple way to add activity to my day.
As for his diet, he stopped eating foods loaded with fat and sugars. His diet now, low-fat, high-protein meals found in his office's cafeteria. Orrin now has the energy and stamina to work out 5 days a week. Plus, he's lifting weights to build muscle mass.
What people don't realize is when they hit their 30s, the muscle mass starts to decrease about 1 to 2% per year. And if you don't have muscle mass, then you're going to gain fat weight, and you're going to have a higher risk for diabetes, insulin resistance, and a lot of other diseases.
Orrin is no longer the couch potato poster child. Check out his old size 48 jean. He's now a size 34. He's gone from 314 pounds to just 177 pounds in a little over a year.
That's unbelievable. He's got to be the poster child of the year with this kind of weight reduction. It's just amazing.
Dr. Houston shows Orrin his test results, proving he's lowering his risk for heart disease, stroke, and cancer.
Now, what's very important for people to remember is that you could reduce the incidence of those 3 diseases by up to 70% just by doing the things I just mentioned. Good nutrition, weight reduction, and an optimal exercise program.
But the best news Orrin's received?
He said, you do realize you have probably added a good 10 years to your life. It takes some discipline, and it takes some thought, and it takes some perseverance. But in the long run, it's a better life.